Good afternoon, everyone. This is Dr. Bhupesh once again for you all recording another question of reading part B and part C, how to do these parts and how we can make these readings easy. So this is a very special question. That's why I'm recording it for you all. Normally, you know that we take regular classes 4 times a week, Zoom classes, but we record only the questions which are very different. Like this question is very different. This question says first, what is the primary purpose of obtaining a patient consent for the review? See, the most important thing when people have weak reading, weak listening, that happens due to weak question reading, that you do not read and understand the question well. So if you do not understand the question well, then obviously your answer will be wrong because ultimately you need the right question. So in this case, they are asking what is the primary purpose of obtaining a patient consent for the review. So now the question is very simple. These are the main words that I would go for. First word is primary. Primary word would be very important because most of the times when I will do a question like this, there would be many purpose, but I have to find the primary purpose. So this can be very important keyword. And second important thing is to understand purpose of what? Purpose of patient consent. That if I am a doctor, if I am a nurse, why am I taking the patient consent? Simple. Now, this is the way you should have the question in your mind. Why, being doctor, I am taking patient consent. So why do we take consent of the patient? Generally, I want you to participate if you don't mind. Just give me a second and please respond me like, what do you think? Why do we take consent of the patient in the medical profession? Why do we take the consents? Yeah, you can participate. I have unmuted you guys.
Well, for security purposes.
For security purpose, that if we want to ask anything from the patient, then we will take consent. Okay, if we are saying you are undergoing some operation, then you have to give me consent. So that can be me. When you read the question, your mind should become activated. That is the first thing. Your mind should become activated. So when you take a patient consent, when the patient is about to undergo operation, then I will take the consent if something happens to you, if something wrong happens. But the question is review. Review means feedback. So what is the purpose of taking patient consent for the feedback? Feedback of maybe medication. Let's see what is the topic. So consent is taken by the doctor or by the nurses for their own safety. It's nothing about patient. It is for our safety. It is for hospital safety. We take the consent. So that is how your mind should start working to make these questions easy. Now I'm going to read this paragraph in front of you. I hope you all would be able to understand. So now I am trying to find what is my benefit being a doctor of taking the consent. Okay. It is the consumer decision to participate in the home medications review. Home medications means patient is taking medication at home and he will give the review. Means if I am having diabetes, doctor will give me insulin to inject at home and I will give you the review that what was my sugar level, how was the medication. So you should understand the topic. Obviously in exam, it will not take much time. Even if I will take the exam, my only question would be why should doctor take the consent? So, but I'm making you understand that's why I'm taking time. Okay. So home medication review process and they may elect to withdraw from the service anytime. So that means patient can withdraw from the service anytime. So this line cannot have my answer because whether the patient withdraw or does not withdraw, he does not need my consent. The question is why do doctor need a patient consent? Because if we are taking patient consent, that means we want something in our favor. So first line cannot have my answer. That is how you save time. And that is why I am taking time at the moment to tell you how to save time. So this line cannot have my answer. Otherwise, you will waste time. Consent of the customer is obtained by the GP when initiating. This line does not have the purpose. This line also does not have my answer. That is how you save time. The consent allows the consumer information to be given to the accredited pharmacist conducting the HMR. So consent allows the consumer information to be given to pharmacy. This is the purpose. That what does a consent? It is given very indirectly. That's why I'm recording this question. What is the purpose of the consent? Consent allows the consumer information. That means if the patient is the consumer, I can give patient's information to the pharmacy after taking the consent. That is my favor. I can tell the pharmacist that your medication is working or your medication is not working. So I take the consent to give the patient information to the pharmacist. So B becomes my easy answer. Very easy answer. So that is how we should do this question. Difficult question, but now in the final exam you will have anxiety, so you can't stop here. And also until now primary word is not given, so still we are confused. If it is final exam, this question I already know because I did it in the class today. I did only one question, so that's why I know the answer. Otherwise, I will read the complete paragraph. Let's read the next paragraph. Next things. All the information throughout the HMR service should be respected, safeguarded, right to privacy and confidentiality. So right to privacy, right to confidentiality is for the consumer benefit. But my question was, what was the benefit of the doctor? Why am I taking consent? So that is how you save time. This line does not have my answer. Please try and understand. Otherwise, you will feel that this question is very difficult. But if you will understand what is the purpose of taking consent, we are taking the patient consent so that we can give the information to the pharmacy. So this also does not have it. This includes all the information, this and this always. Confidentiality needs to be maintained through the development of secure files. Again, it is putting pressure on the doctors that you need to maintain the confidentiality. So this cannot be the purpose. Purpose should be something in the favor of doctor or nurses. This includes ensuring any concerned information, if transmitted electronically, use encrypted. Now they are giving the instructions that how should we pass on the information of the patient to someone, but they are not giving the purpose. So that is, this question is very, very difficult question in the final exam if it comes. But the person who understands the question well, that purpose means why, then you will be able to find this question. So nothing in this paragraph is important except one line. Consumer consent needs to be obtained for the medication reviews to be conducted and the associated sharing of necessary information between the healthcare providers. So that is second purpose. We can share the information with other healthcare providers. So only two lines are given, 1 and 2. HMR service provider confirm the appropriate consent has been obtained. Again, extra information. I wanted purpose. So one purpose to the pharmacist, second purpose to the other healthcare providers. To give patient the liberty to participate or withdraw from the service. If you do not understand the purpose, you will pick it from the first line and will do A. But it is wrong because it is not the purpose. It is the way. It is the process. It is not the purpose. Then B we have already done. To ensure that information is safeguarded, this is not the purpose of the consent because doctor take consent to share the information. So again, if you would have reacted like a proper and well-trained medical professional, purpose of the consent is to share the information and is to tell the patient if something wrong happens, then it is the part of the operation. So we can't do. Only two can be the purpose of the consent. In your practical world, you take consent for this. So if you will understand these things, then you won't have to focus on anything. You will read only this line and this line. This will save your time, energy, and everything. This is not the purpose. This is not the purpose. So please listen to this video again. I'm telling you again and again, one time is not enough. As I am taking so much of effort to do one question only, so obviously I want you to learn. Let's see this question. Question number 3. You asked me 2 questions, so I'm doing the second question now. Okay. Now there is another word that again focus on primary words. Emphasizes. Emphasizes means putting stress. I am putting stress on something, like in the last question, I was emphasizing that question should be read very carefully. So now they are saying the note emphasizes the significance of the difference by, means this paragraph would be talking about some difference between the two things, and what is the importance of difference. What is the importance of difference means if there are two things, if there are two persons, Ram and Sham, if they are different, why they are different. So again they are asking about the significance of the difference. Please understand the question. They are not asking what is the difference. They are asking what is the significance, means what is the benefit of difference. So I need to find what is the benefit. When you simplify the questions in your mind, then your answers become easy. Then you can focus on the right keywords. So I will read it again for you guys, the paragraph. Let's see how it goes. Whether it's a tough one or easy one, we will try and resolve it. Okay. Aggregated versus disaggregated data. Obviously, I understand this vocabulary. Aggregated means aggregated. Disaggregated means separated. So there are two kind of data, aggregated and segregated. So we have to find what is the benefit of having two different data. What is the benefit of having two different data? Okay. To ensure that the services reach people in the need and that nobody is left behind, strategic information needs to be usable in a way that helps the people, places, situations where the interventions are needed. So that the services can be provided in the right way, we need the right data. Otherwise, there is no benefit. As building blocks of strategic information, that means we need strategy so that our services reach to everyone. So the building of strategic information, data can be combined or separated for different uses. That means they are talking about the different use of the data. Please understand, data can be combined or separated for different uses. That means they are trying to differentiate this data aggregated and separated by its usage. Usage is the main word. Aggregated data are combined from many sources and summarized for a specific purpose. That means aggregated data is used for a specific purpose. That means use of the aggregated data is for specific purpose. When aggregated data are separated again according to they become disaggregated data can inform decision making and planning so that interventions more effectively reach people. That means they again are telling that aggregated data is used for this purpose, disaggregated data is used for information making, for decision making and planning. That means they are trying to differentiate the data according to its usage. So indicating the contrasting purposes, contrasting means different purposes. Yes, aggregated data is used for specific purpose. Disaggregated data is used for information decision making. So they have contrasting purposes. This can be very strong option. Highlighting the information value, nothing like this seems to be an answer because the purpose was the main thing was given. The main thing that was given. Exhibiting the distinction in the outcome. Outcome means result. They are not talking about any of the outcome or any of the result. So you need to understand they are exhibiting means displaying the distinction in results. They are not talking about any results. They are talking that if you want to provide the right services to the people, strategic information is very important. For the strategic information, a data is a building block. Data is the pillar to provide the strategic information. Data is divided into two parts, aggregated and disaggregated. Aggregated data has this purpose, disaggregated has this purpose like decision making and this. So they both have contrasting purposes. This question was little tricky, but the way I say, some questions are tricky because of their vocabulary. But if you do not overthink, only word that was given was purpose. Means if there is a very difficult question in the exam, go for the easiest of the option because difficult question will always have easy option. Like in this, the paragraph was talking about purpose. In the same way, only option that is matching is purpose. So aggregated data is for the specific purpose such as statistical analysis, and disaggregated data is for other purposes like decision making and planning. That is the difference between the two. Contrasting means difference. Like in the TVs or in the computers, we say contrast. Contrast is like either black and white. It makes the images very distinct. So please listen to this video 2 times, 3 times, 10 times, because every time you will listen something new. This will not only improve your listening, but also will surely improve your reading. It will solve both the purposes. But if you listen to it one time, you do not understand what I am saying. If you listen to it 2 times, you understand. Third time, you implement and it becomes yours. You become the power. So if you want to become powerful, please listen to this video 2, 3 times. This is Dr. Bhupesh from Dr. BKM OET Institutes. Please keep listening to our videos for your own benefit. And I'm stopping this recording and expecting that everybody will listen to this recording for 2, 3 times.